Okay, so let's go ahead and get started. First of all, welcome. Thank you so much for joining me today for this webinar. Um, I am Dr. Savarta Khalsa, and I have my practice here at Living Wellness Medical Center in the beautiful Arcadia area of Phoenix. And today I'm going to be talking about the physical effects of stress and what you can do about it. So I really like talking about this topic and treating patients that struggle with stress and adrenal issues, which we'll talk about, because naturopathic medicine really shines in terms of being able to have so many wonderful tools to help support people through stress and kind of bring your body back to health. And so I really love talking about this topic. All right. So let's go ahead and get started. So first off, let's talk about stress. You know, what is stress? We talk about stress a lot these days. We all kind of know what it is. We experience it on a day-to-day basis, but we haven't always understood really what stress is and really what the physical effects of stress are in our bodies. So Dr. Hans Selye, who is a Hungarian-Canadian endocrinologist, is considered the father of the field of stress research. And he did a lot of studies back in 1936 about the effects of stress in the body. And he actually used, of course, animal studies to research this. But he did a lot of research and kind of sort of coined the term stress. And he defined stress based on his studies. He defined stress as the nonspecific response of the body to any demand for change. And so what does that mean exactly? So in 1936, he did animal studies to show the physical effects of emotion, illness, and injury on the body. And so he took laboratory animals and exposed them to noxious stimuli. So things like really bright lights, a super loud noise, extremes of heat and cold, repetitive frustration, things like that. And he recorded what the physical effects were in those animals after doing this. And what he found is that it has a tremendous impact on the physical body, and sort of really cemented that concept of mind, body, and how closely they are connected. And so what he found is that stress, especially intense and or chronic stress, resulted in stomach ulcers. We all kind of know that association, right? Stress causes ulcers, shrinkage of lymphoid tissue or your immune system. That's a big part of your immune system, and enlargement of the adrenal glands. And so, and long-term persistent stress, he found, led to heart attacks, stroke, kidney disease, and rheumatoid arthritis, among other things. We know that there are lots and lots of detrimental conditions that can be caused by chronic, unrelenting stress. So that's kind of the beginnings of our understanding of stress and how it affects our body. So what are the causes of stress? We all kind of know what these are, but let's talk about them a little bit. So probably the biggest and most common thing that we think about is mental emotional stress. We all experience that at different times in our lives, some more than others. And the two that I think are probably most important are around work and home. Because if you think about it, this is where we spend literally all of our time, right? You're either at work or home mostly, unless you're maybe on a 2-week vacation or something like that once in a while. But mostly we're working, we're at home. And so if you have a really stressful job, maybe a demanding boss or just a really tense work environment or just a job that you don't care for and you don't really like, that is a stressful environment that you're spending a lot of hours of your day and therefore your life having that stress. Similarly, at home, if you have a really stressful home life, challenging relationship with your partner, or really difficult, challenging kids, which some people do, or just sometimes just the day-to-day of keeping up with it all. We all struggle with that, especially, working moms, single moms, working moms. It's a lot of work to juggle it all. And then, of course, outside of that, any sort of acute emotional stress that might occur can be really impactful. So things like the loss of a loved one, having to move, changing jobs, all of those things can put you in a state of stress. And then there's physical stress. So some people deal with chronic pain that will put stress, or it will basically put extra demand on your adrenal glands, which we'll talk about, on a constant, regular basis every day when you have chronic pain. And so that will take its toll on your adrenal function. Also, any kind of chronic illness, that it's a challenge to your body. Your adrenals, once again, are kind of, play a role in trying to get you through that and get you through the day. Lifestyle. So some people have a lifestyle that is go, 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 go with no rest. And, we all kind of know who these people are. Maybe you're one of those people where you just have a really busy life and, high achievers and constantly doing, and not really taking the time to just be, doing instead of being. And so that, some people can get away with that and deal with it for a while, but eventually that kind of level of busyness will catch up with you, even if you're that kind of type A personality that thrives on that. So it's really, really important to allow yourself to have that time to rest and restore. And then things like PTSD. Some people are exposed to trauma during their life and end up with something like PTSD. And these people tend to be triggered into that stress response really easily and really intensely. And so, things that, most people wouldn't consider to be super stressful or a trigger, these people that have PTSD, it puts them in that stress response. So that needs to be addressed. So what happens in your body in response to stress? So let's talk about some glands. So we have in our body what's called the hypothalamic pituitary adrenal axis. We call it HPA axis for short. Hypothalamus and the pituitary gland are both located in your brain, and your adrenal glands are located right on top of your kidneys. And so when you are exposed to stress, your hypothalamus produces a hormone called CRH, also called corticotropin releasing hormone. And that then stimulates your pituitary gland to produce ACTH, adrenocorticotropic hormone. And that then stimulates your adrenal glands to produce cortisol. And cortisol is our main stress hormone. But your adrenals also secrete some neurotransmitters called epinephrine, also called adrenaline, and norepinephrine. And these are both of these both the hormone cortisol and these neurotransmitters are released from your adrenal glands in response to stress. So that's physically what's happening in response to stress in your body. So what are the immediate effects of stress? Cortisol has the effect of increasing blood sugar in the bloodstream. It enhances your brain's use of glucose or sugar and increases the availability of substances that repair tissues. So if you think about it in the short term, that's not a bad thing. If you're faced with a stressful situation, you want to have mental acuity. You need that sugar for your brain to function properly. And if maybe part of that stress is maybe an injury or something like that, guess what? The cortisol helps to increase availability of those substances that help repair tissue. So that's a good thing. That's a positive thing in the short term. So epinephrine and norepinephrine have the effect of increasing heart rate, increasing breathing rate, They dilate blood vessels to the lungs and the muscles, and they decrease digestive function. So sort of the classic example of that in that fight or flight mode, when you're maybe in the jungles of India, if you happen to be, and you're faced with that tiger, you're going to need the resources to either fight the tiger or run away. Hopefully, I think your chances of survival are greater if you run away. So hopefully that's your choice. But to run away, you need, oxygen and blood to your muscles, and you need, your lungs basically to be working well so that you have that extra oxygenation going to your tissues and your cells and your muscles. Similarly, you don't need to be digesting your food at that time. Your immediate need at that time is to deal with the stressor, to deal with that stress and, get away from it or deal with it in some way. So, in that situation where you're faced with the tiger and maybe you run away or something like that, there's, it's a positive thing. It helps you to deal with that stressful environment and that stressful situation, but you have an outlet for it and there's an end to it. It's acute, and then you get away from the tiger and you're fine. But if you have this kind of stress reaction, sitting at your desk at your office all day long, or many times throughout the day, you don't really have a release or an outlet for all of those physiological effects that are happening in your body. And that can really start to have a detrimental effect. So we'll talk about that. So let's talk a little bit about the adrenal glands and what they do. So the adrenals are pyramid-shaped glands that sit right on top of the kidneys. In fact, the word adrenal comes from, so renal is another name for kidney, and ad means sort of on top or above. So adrenal is on top of the kidneys. And that's where that name comes from. And so your adrenals are involved in the fight or flight response. Cortisol helps to regulate your blood sugar. And so, like I said, when cortisol is released, that actually increases your blood sugar. And so once again, if you have chronic, constant release of cortisol from your adrenal glands, guess what? You're having constant chronic high blood sugar. And that can eventually lead to prediabetes and eventually diabetes. So stress is a big factor when it comes to blood sugar regulation. It also helps to regulate blood pressure with a number of different mechanisms, but one of the hormones that your adrenals secrete is aldosterone, and that regulates blood pressure. And so your blood pressure can be either too high or too low, depending on the scenario and what's happening inside of your body when you have adrenal issues and dysfunction. Your adrenal glands also produce sex hormones. A lot of people don't know that. And so your adrenals produce a hormone called DHEA, which is a precursor to your other sex hormones, so testosterone, estrogen, and progesterone. So when a woman is going through menopause and that transition, if she has nice, strong adrenal glands, it kind of helps to buffer and help her through that transition a little bit, because even though her ovaries are declining in their function and maybe not producing as many of those hormones as they used to, the adrenals can kind of, take up the slack a little bit and produce some of those hormones so that the transition through menopause is a little bit easier. So if I have a menopausal patient that comes in and has a lot of stress and has a lot of menopausal symptoms, in addition to maybe the hormonal treatments that I might recommend for her, I will also typically test adrenal function and support there if needed, because it's really very helpful. So how does stress affect your body? So we have this fight or flight mode that we get into with acute stress. And in the short term, as I said, it's a beneficial thing. It helps us adapt to stress, to kind of deal with whatever situation we're presented with, gives us energy to kind of move through that situation or move through the day. So to a certain degree, stress is not all bad. And, we talk about, living a stress-free life and things like that. And to a certain degree, the concept is nice, but, the reality is that we always have some sort of, stress or stressor happening on a day-to-day basis. And it's, like I said, it's not always a bad thing. It's just when it's too much. So chronic stress or high cortisol has a damaging effect on the body and on your mind. And so it can lead to a loss of minerals and muscle tension, especially with the loss of calcium and magnesium and potassium potentially. That will lead to muscle tension because those minerals are extremely important for muscle relaxation. Also, it can lead to increased acidity in your body. Generally, as a rule, we want our bodies to be more alkaline as opposed to acidic. That's a much healthier state to be in. And so too much cortisol will actually increase your acidity. And that can lead to a lot of different chronic illnesses, including cancer. And so that's a negative element or aspect of too much cortisol. And there are, of course, things that you can do in addition to stress management and things that we'll talk about to help your adrenal function, things like that. You can drink alkaline water. You can eat a healthy diet with lots of fruits and vegetables. There are a lot of things that you can do to help decrease that acidity as well. Decreased immunity. There's a very close connection between stress and your adrenals and how well your immune system is functioning. It can definitely lead to digestive problems. And this is a common thing because once again, when you're in that stress mode, it's shutting off or shutting down or minimizing your digestive function. And so it can lead to a lot of issues, especially if you're one of those people that doesn't take time out to really relax and eat your meal and chew your food. And you're just sort of eating on the go and you're stressed out and things like that, your digestive system's not going to be working very well to digest your food and absorb those nutrients. It also can inhibit thyroid function, and it has a pretty direct effect here where it actually can inhibit the conversion of T4 to T3. So your thyroid gland produces two different hormones. T4, 80% of T4 is produced, and that is the inactive form of thyroid hormone. That has to get converted into T3, which is the active form of thyroid hormone. Your thyroid produces about 20% T3. But T4, it's primarily relying on your body to convert that T4 to T3. And stress has a direct impact on that, on blocking that conversion. And so we see thyroid issues a lot when you have a lot of stress and adrenal problems. So do we all respond to stress the same way? The short answer is no. We are all different. We're all wired differently. We all know that, right? We're individuals. We're different with our genetics and how we deal with things and, the health conditions that, we might be challenged with during our lifetime. Just, we're all different. And so, yes, we all can respond to stress differently as well. I have some patients that have, 3 jobs and 2 kids and, they're busy. They, part of this club and that thing and socializing, just everything. Like they're super busy and have very busy go lifestyles. And I'll ask them, well, how's your stress level? It's not bad. So that is a person that clearly can sort of deal with busyness or stress really well. And then I have maybe other patients that, are maybe half as busy and they feel overwhelmed all the time and really stressed out. And so we're all different that way. So it's important to talk about those sorts of things too. And I always do with my patients when they come to see me. So I'm going to talk about, so this is some information that I borrowed from a really great book that I have called Master Your Stress, Reset Your Health by Dr. Donnie Wilson. She's a fellow naturopathic physician. And I really liked how she outlined kind of the different sort of stress types that she observed. And I agree, I have seen this as well in my practice. So I'm just going to go through each stress type, and it might be interesting for you to think about, what stress type are you? So the first one is a stress magnet. These are people that choose high stress jobs. They tend to be type A personalities, those overachievers, constantly feel best actually when they are go and constantly doing. So these people tend to have high cortisol and high adrenaline. Now, that doesn't mean that eventually, even though they thrive on that kind of lifestyle, it doesn't mean that it isn't still having those physical detrimental effects in their body, especially over time. You can kind of get away with that sort of lifestyle for a while, and then it typically starts to catch up with us, and we can start to have health problems. And that, is what gets our attention, that, okay, we need to slow down a little bit. So things that can occur with these people, digestive issues, hormonal imbalance, anxiety, things like that. Then we have the night owl. And so the night owl is tired or feels okay during the day, but they get lots of energy at night. Maybe they're tired all day, and then around 6, 7, 8 o'clock, they get sort of this second wind. And all of a sudden they have all this energy, and they want to get all, a project done, or get all the stuff done that they didn't have energy for during the day, which is okay. However, that tends to interfere often with sleep. And so, when it is actually time to wind down and go to sleep, they can't. And they're just laying there wide awake in bed, unable to fall asleep. And of course, we all know how important sleep is for stress management and for health in general. So that's not a good thing. And so these people tend to have high cortisol and adrenaline in the evening. And so they have issues with insomnia and digestive issues, among other things. And so that having that cortisol too high at night for these people, there are actually very specific treatment strategies that we can utilize to help bring those evening or nighttime cortisol levels down, so that that is conducive to getting good sleep, good quality sleep. Then we have the sluggish and stressed. And for these people, they have energy in the morning. They wake up feeling pretty good, but they lack stamina. And so they kind of peter out through the day, their energy and their ability to get things done. And so, maybe you have that sort of afternoon lull where you just, you feel tired. And so these people tend to have high cortisol and low adrenaline. And they tend to lack motivation. They have a lot of joint pain and inflammation and anxiety. And then the next is we have blah and blue. And these people are tired, depressed, and unmotivated all day long. They wake up feeling that way, and it just is all day and unrelenting, and they just feel terrible. And they tend to have low cortisol and low adrenaline. So everything's just kind of hypofunctioning. And so in the morning or midday or all day. And so they tend to have brain fog, migraine headaches sometimes, thyroid issues, potentially digestive issues, and things like that. And then we have the tired and wired. And these people tend to be anxious all day long. There's anxious people feeling anxiety all day, tired. They feel tired, but they can push through the day. And these people tend to have low cortisol and elevated adrenaline. And so they tend to have low immunity and hormone imbalance, and among other things. So these are the different stress types. Maybe think about which category you might fit into, and maybe there's some crossover, and some elements of different ones fit your how you are. So, and in treating these different stress types, your treatment strategy might be a little bit different in terms of maybe when you plan to do some of your restorative treatments and things like that, like exercise and whatnot. You're going to have more benefit from that depending on, what kind of stress type you are. So what are the symptoms of adrenal dysfunction? Number one is fatigue, for sure. Most people that have adrenal dysfunction feel tired, whether their cortisol levels are too low or too high. You can have fatigue with either. And a common one also is sleep issues or insomnia, especially if your nighttime cortisol is too high. That will interfere with sleep, whether it's with difficulty falling asleep or waking up frequently throughout the night, or waking up too early in the morning before you really want to. I have patients that say, yeah, I wake up at 4 o'clock, my alarm's set for 5:30, and I just wake up at 4 wide awake. And it's, of course, earlier than they really want to, and it's shortening the amount of sleep that they get. Blood sugar dysregulation is another common thing, like I mentioned before. Mood problems, irritability, anxiety, depression. These are all things that can be caused by or worsened by adrenal dysfunction. You know, people tend to have, when they have adrenal dysfunction or especially adrenal fatigue, they tend to kind of have a shorter fuse. You know, they get irritable or snappy really easily, and maybe things that didn't, stress them out or irritate them before, now they do, and they're sensitive to little things. And so that is definitely a sign of stress or adrenal dysfunction. Allergies and autoimmune conditions. This is a big one. That's basically a hyper, like an upregulation essentially of your immune system, a hyperreactivity. And this can be caused or worsened by adrenal dysfunction. And, part of that goes back to the gut and digestive function. As we talked about, when you have stress, that inhibits digestive function, and 70% of your immune system is in the gut. So if your gut is not functioning well and you're not absorbing your nutrients well and things like that, that can be a contributing factor to allergies and autoimmune conditions. Increased colds and flus and decreased immunity. That is a common thing that we see as well. Joint or muscle pain, basically more inflammation and joint pain, things like that, especially when cortisol levels are low. Cortisol is actually a natural anti-inflammatory. And so if you're lacking cortisol, which can happen, after you've had stress for a period of time and your adrenals kind of get fatigued and they just can't keep up with that demand anymore, your cortisol levels end up being low, too low. So you feel tired and you're lacking that anti-inflammatory effect. And so you have more joint and muscle pain. Weight gain. This can be also a symptom or an effect from adrenal dysfunction and stress. We see this a lot. There's a lot of crossover, as you can see, with the symptoms that might present with adrenal dysfunction and thyroid disorders. And so, it's really important to check both. In the conventional medical model, they're pretty good with checking thyroid. Most doctors will include that as part of, kind of your annual lab test, your screening tests and things like that. But they don't test adrenal function. So the adrenals kind of get ignored. And I have so many patients that come in thinking that they might have a thyroid issue, or maybe their doctor checked their thyroid and checked for anemia and they're feeling tired. And all their labs are normal, but they feel terrible and they feel tired. And, maybe their doctor, in trying to help, well, maybe you're depressed. No, I'm not depressed. I'm just tired. And so a lot of times they get put on, SSRIs and antidepressants when they really don't need to be on those things. They just need their adrenals to be supported. So naturopathic physicians, we know the importance of the adrenal glands and how they are really the foundation of our health. And so we go out of our way to always evaluate and look at adrenal function. And I'll talk about how to test adrenal function in just a little bit. So weight gain is definitely a common thing that we see, especially, abdominal weight gain. And so cortisol has the effect in the body of mobilizing fat and redistributing it to the abdominal area. So you've probably all seen those commercials, cortisol belly. And so, that's what it does. It increases fat distribution to your abdomen. And then, eventually your cortisol levels maybe become too low, and then you just can't lose weight at all. And so it becomes very difficult to lose weight. It can also, so another symptom can be high or low blood pressure. Just the effect that I mentioned, how the adrenals produce hormones in a number of different ways where they affect blood pressure through aldosterone and other mechanisms. Okay, so how do you test for adrenal function? There are a number of different ways. And so you can do a simple blood test. And I do this all the time with my patients. With a new patient that comes in, I always include that. testing morning cortisol with the labs that we do. And basically, that is just, it gives us a general idea. So cortisol has a natural rhythm to it, which actually you can see in the diagram below, where it is highest in the morning, and then it slowly declines throughout the day, and it should be nice and low at night, which is conducive to getting good sleep. And so what we're testing with the blood test is just a morning cortisol, because if you think about it, you're not going to go in for a blood draw four times or 5 times throughout the day, or at 10 p.m. That's just not reasonable to do that. So we're at least getting that morning reading to get an idea, is it too low? Is it too high? And that gives us a general idea. If we want to get a little more detailed with our look at the adrenals and cortisol, we can do a test that's called cortisol times 4. And it's a salivary test where it's basically a kit that you take home that we provide for you at our office. And you collect those saliva samples 4 times through the day. And so you're taking a morning sample, maybe noon, 4 p.m., and then before bed, maybe around 10 p.m., 9 or 10 p.m. And when the results come back, it graphs out what your cortisol rhythm looks like, because it's important to look at your levels, but also your rhythm as well, because sometimes your rhythm can get thrown off and your cortisol levels are too low at night. Too low in the morning and they're too high at night. Or you're having, some irregularity throughout the day. Maybe they drop really low after lunch, So it allows us to kind of look at this circadian rhythm and your cortisol rhythm in a little more detail, and we can treat it a little bit more specifically based on those results. So I really love this test. There are a couple other sort of in-office tests that honestly we don't really use, at least I don't really use them very much in my practice anymore, just because I find that the blood test and the saliva test to give us really important, objective, valuable information that helps evaluate adrenal function. But just so you know, there are a couple of tests that you can do. One is called the pupillary response test. I learned about this in naturopathic medical school over 20 years ago. But basically what you do is you shine a light in your eye. And when you do that, your pupil should restrict. That's a normal response. And it should be able to hold that constriction. If you have adrenal fatigue, what you'll see is your pupil will sort of, it'll go up and down, and it will, it'll hold it, but then it'll get large again, and then small again, and large again, and kind of pulsate. That's the word I'm looking for. So it kind of pulsates, and that is a sign. It can be a sign of adrenal fatigue. Another one is orthostatic hypotension. This is a test. You're testing your blood pressure, basically. And so it is a normal response for your blood pressure to go up. When you go from a laying to sitting or sitting to standing position, your blood pressure should go up with that. And with adrenal fatigue, typically your blood pressure will actually go down. And so you can test blood pressure in each of those positions to see what it's doing. Also, because your blood pressure should be going up, but it's going down, you can feel dizzy with that. And so that can also be sometimes a symptom of adrenal fatigue as well, is dizziness on standing. So what helps support our adrenal glands? There are so many wonderful tools and so many wonderful things that I'm going to talk about. So the first thing is nutrients. There are some key nutrients that are especially important in supporting your adrenal function and your adrenal health, specifically the B vitamins. Vitamin B5 or pantothenic acid is the most important B vitamin for adrenal support. And so a lot of times with adrenal supportive formulas, that have a combination of things in them, there will be a nice high dose of vitamin B5, maybe 200 milligrams or something like that. Vitamin C is also really important, and magnesium. And so these are key nutrients that are needed for adrenal support. Herbs. These are herbs that we call adaptogens. I love adaptogens. They're amazing and wonderful, and they work so well. Probably one of my favorites is ashwagandha. I use that a lot in treatment with my patients that have adrenal fatigue and adrenal dysfunction. It's used extensively in India. It's an Ayurvedic herb. wonderful. Sometimes I'll use it by itself. Sometimes I'll use it in combination with other herbs. Often I will. Comes as an herbal tincture and a capsule, different ways that you can take ashwagandha. Glycyrrhiza or licorice. This is a wonderful herb to use for adrenal support. It actually has the effect of basically it increases the half-life of cortisol. And what that means is that it keeps cortisol around longer when it is produced or secreted by your adrenal glands. And so there's less need to produce it. And so licorice is really helpful. It is contraindicated, though, in people that have high blood pressure. It can make high blood pressure worse if you have high blood pressure. However, in a person that has normal blood pressure, it will not increase and elevate your blood pressure. So that's only a concern with people that have hypertension. Eleutherococcus, also called Siberian ginseng, is wonderful. Rhodiola, holy basil, also called tulsi. In India, they use it extensively there as well. Schisandra and maca. So these are all wonderful herbs that do a great job of supporting and tonifying your adrenal glands. And just keep in mind, though, it's not an overnight process. I mean, sometimes you can feel a little bit better right away when you start taking an adrenal formula or herb, but it's slow and steady over time. It does take time for your adrenals to recover. And so it's important to be patient with the process and keep up with the treatment. It could take, 3 months, 6 months, sometimes even a year, depending on the level of dysfunction and fatigue for your adrenals to fully come back to health. Another one of my favorites is nutritional IVs. These are wonderful because we're using the nutrients that are 100% absorbed. They go into your bloodstream and right to your tissues and your cells where they're utilized. And so you don't have to worry about, taking them orally. How much are you actually digesting? Do you have digestive issues? Those sorts of things. We know that they're 100% absorbed. And so in the most common one that I use is called a Myers cocktail IV. And it's contains high dose vitamin C, the B vitamins, calcium, so B5, B6, B complex, all the B vitamins, or most of them, calcium, magnesium, zinc, and selenium. So I will often recommend Myers cocktail IVs for my patients that have a lot of fatigue, and especially if it's related to adrenal fatigue. And it does a wonderful job of helping to boost up their energy and help them feel good again. And I also use these IVs a lot with immune depletion, my patients that get sick a lot or just feel like they need a boost. These IVs are wonderful for that as well. The frequency of the IVs in terms of my recommendations really is very individualized. So it could be, once a week for 6 weeks, 4 to 6 weeks. It could be every other week. It could be, they come in once a month. So it really depends on the person. And of course, what they want to do as well. And, how severe the adrenal fatigue or fatigue is. But they're super, super helpful. Also, of course, the foundation has to be lifestyle modification and stress management. We talk about this a lot, right? We all know kind of what the stress management techniques are with meditation and yoga and, really figuring out what brings you joy in your life and making time for that. I think that sometimes we get so busy with the hustle and bustle of everyday life, we forget about that. And we don't carve out that time for ourselves and for that self-care and, finding meaning in our life, and all of that is super important. And so lifestyle modification is always something that we discuss in treating adrenal dysfunction and adrenal fatigue. And that includes, of course, diet as well. So ultimately, the goal is, taking care of you. That's so, so important. And we all need, I think, constant reminders to do that. So I also borrowed this little acronym from Dr. Wilson's book because I like it. It's very simple yet powerful and true. So the acronym is CARE. And the C stands for clean eating, right? We all, we know we need to eat a healthy diet. We all know that, right? a whole foods, primarily plant-based diet with good quality proteins, good fats, trying to avoid the processed foods and the sugar and the alcohol and the caffeine and all of those things. If you do those things, really in moderation, but eating really clean and really healthy in a reasonable and balanced way, right? That's important too. A is adequate sleep. I cannot emphasize enough how important this is for our overall health, but especially for your adrenals and for stress management. So, because think about it, that's the time that our body really has to rest and rejuvenate. And we need that sleep. And, the amount of hours that each person needs can vary a little bit. Some people are pretty good with 6 or 7 hours. Some people need 8 or 10 hours, so your body will tell you. Most people kind of know, they have a feel for how many hours of sleep they need to feel their best. The R stands for recovery. And so once again, when you're in that go, go, go mode and you're not allowing yourself time to recover and to rest, that's going to catch up with you. And so it's really important to make that a priority and make time for that. The E stands for exercise. It's important to move our bodies every day and get things circulating and flowing. And that just helps, of course, our overall health in every way. But it's also really important as a part of recovery from adrenal fatigue. So in conclusion, we are all exposed to stress. We can't avoid it. We all have stress at different times and different levels. Like I said, stress is not always a bad thing. But if it's too high or too prolonged, that's when it can become a negative influence in our lives. So it's important to recognize this when we're chronically stressed and to take steps to be proactive in protecting your body from the damaging effects of chronic stress. And so just know that it is possible to change and heal your body and to feel better. So with that, I want to thank you for attending this webinar today. Hopefully you learned something. And if you feel like you are one of those people that is struggling with adrenal fatigue, feel free to reach out. I and every doctor here at Living Wellness Medical Center offer a free 10-minute phone consultation, kind of a meet and greet, where you can kind of let us know what you're needing help with, and we can share with you what our approach would be and just make sure that it's a good fit. So here's my information on the last slide here. Feel free to reach out. Feel free to check out our website. We have lots of fabulous information on our website. And with that, I would like to open it up to questions. If anybody has questions, you can put them in the chat on the right on the screen there, and I will answer any questions. No questions so far. We'll see if any kind of peter in here. Kind of. Okay. So, and just so you know, also, if you want to rewatch this webinar later, it is available through our website, livingwellnessmedicalcenter.com. And you can go to free resources, and then within that, you can click on past webinars, and you can view it. Also, if you maybe have a friend or a family member you think could benefit from this information, you can share that with them as well. And it takes a couple weeks, 2 or 3 weeks, for it to show up there, just so you know that. All right. Well, I don't see any questions coming in, so I will end my presentation here, and I will see you for the next one. I'll see you next time. All right. Thank you so much.